According to the World Health Organization, palliative care is an approach that improves the quality of life of patients and their families facing problems associated with life-threatening illnesses, through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychological, and spiritual. Hospice care has the same outlook and goals as palliative care. However, as defined by the Medicare hospice benefit, hospice is a healthcare delivery system under which the patient chooses to discontinue curative treatments for their terminal illness. The process of growing older never slows down. No matter what efforts people go through to alter or prolong their youth, it is inevitable and irreversible. Due to the increase in life expectancy, in the past 10 years, Australians aged 85 or older has increased by 150%. What happens when the elderly are no longer able to take care of themselves? Or when a loved one develops a life-threatening illness? That's when palliative and hospice carers come in. The origin of hospice and palliative care are found in hospitality and places of welcome, maintained by early Christians to care for pilgrims and travellers. One of the most influential models of hospice care was founded in England in the 1960s by a doctor called Cicely Saunders, who came across a Jewish refugee with terminal cancer. Together, they both formulated the idea of having a place to relieve the pain and die with dignity. With the vision of having patients die within an atmosphere of tranquility, Australia now has a wide range of different palliative and hospice care facilities around Australia. According to Lofmark 2006, a survey was conducted on the training of doctors for palliative care. Results showed that less than half of doctors felt they had adequate training of pain and symptom control. With this result, Lofmark also states that doctors and physicians responsible for patients with terminal illness should commit to palliative care training and be aware of its substance. This graph shows the percentage of patients who die during hospitalisation under both palliative and hospice care in Australia. In the past 40 years, palliative and hospice care programs have come a long way. End-of-life care has been identified as a topic for the breakthrough in the healthcare improvement. The series of care at the end of life focuses on pain management, advanced care planning, and family support. With the recent incorporation of hospice and palliative care programs in hospitals, nurses are given time to get to know patients and their families, assigning responsibility to patients rather than tasks, personalising and humanising the approach the hospital has with each patient. Living with a grandparent that has Alzheimer's and a carer at home, I get to witness the constant care and help that someone with a terminal illness requires. From eating to showering, grooming, standing, and communicating, simple daily tasks become impossible. But thanks to palliative carers, these tasks become possible. It is crucial to recognise the importance of palliative and hospice carers, as one day you will most likely need the help and assistance of one too. Possible improvements on raising awareness on the importance of palliative and hospice care is by encouraging private foundations to involve the mass media in public education about the nature of dying and ways people can be helped to have a stress-free death.